Hello, and welcome to Behind the Mask Eating Disorders Unveiled. I am here with Brian Vixler.
Hello, good to be back.
And we are really excited about this particular episode for many different reasons. I know we've been wanting to discuss treatment centers, the treatment process for a very long time. But on top of that, you received really exciting news that you will be going back onto the Dr. Oz show. What is it, next week?
Next week, not sure the air date,
Okay.
but I fly back to New York to return to the show. Last year I was on the show, an episode that focused on pro-anorexia, and probably checking what I'm up to these days, which is part of the what we're doing here now. And I agree, this is I've been wanting to talk about this topic for a while. We've touched on it briefly, talking about my experience,
Yes.
your working experience, but this is really important because people, when they're in that position, we know what eating disorder is now. What do you do when you feel like you're helpless? I mean, there's so many options. It's difficult to figure out what to do, to navigate through the insurance process.
Yes.
So I think this is going to be an awesome episode.
Yeah, I think we did a panel. We spoke on a panel of Sunday Melissa for Project Heal, and one of the things that I noticed and stood out to me was how many questions some family members and some people had, and the response even in different forums, message boards, is it seems so overwhelming, the whole process of what will insurance cover, which treatment center, how do I know what to look for, that a lot of people don't know where to go for those answers and where to look.
And we can start by just looking at my own journey. Yeah. A big part of my story is my attempt to get help. It began with, initially I went to treatment because my parents wanted me to. It was a treatment program that was paid out of pocket. And we didn't really have any options. It was one place in the country that treated men at the time, and that was 13 years ago. And then after that experience, when I was back into the disease, it was from that point on a very, very difficult process of getting the help I needed. I appealed twice to my insurance company. I was denied twice. And it was an 8-year journey to actually get help. So that was a big part of my recovery process, was actually getting into treatment. And nowadays, there are so many options out there. Insurance is really the determining factor of whether or not you can go to a certain place.
Yes.
But I think it's really important to know what to ask when you're actually seeking treatment, trying to assess at what level a person would need help, and knowing the right questions to ask a treatment center when you're looking into them.
From your experience, what is, I guess, the number one thing that people out there should look for when looking at treatment centers? We'll go into the different levels of care, but what is the number one, regardless of the level of care, that you think is really important for people to seek when looking for treatment centers?
Well, again, I think bottom line for me, and I keep going back to it over and over and over, is a meal plan. A meal plan with moderation and variety. There are some treatment centers out there. My experience was with Rosewood in Arizona. Yeah. It was an amazing structure in that it was all about moderation and variety and following a meal plan. There are other programs that are structured and give you that, the support you need, but, I've heard of treatment centers that almost like exposure therapy, where they go to an extreme with the meal plan, challenging you with various types of food, where there isn't the variety. For example, I know one person, she had to eat 3 donuts in one day because it was a challenge. And we ate donuts at Rosewood, but it was like once a week we do a dessert challenge and we'd have a donut. But to do it 3 times a day, I mean, it was almost traumatic in itself.
Overload exposure almost.
Yeah. So I don't know if exposure therapy is used for OCD. I don't think it works for eating disorders.
Yeah.
I think, so the key for me, and this is what I've discovered in a lot of programs, and we've talked about it before, is abstinence.
Yes.
That is the number one thing you want in a treatment program, no matter where you go. And abstinence means stopping the behaviors, not engaging in any of the activities related to eating disorder, and getting on a meal plan.
What is the best way that you think that people who are looking for treatment centers, looking into programs, can look to assess if there is abstinence implemented and highly monitored in their program? Is there something that you think people should look for, ask to make sure that is something that's implemented?
It's tough. Oftentimes you're in crisis when you're trying to find a treatment center. I've experienced it myself with a loved one. Here in Orange County, when I've explored 4 different treatment centers, and one of them didn't have a basic meal plan. So once the person went there, they were able to restrict the entire time, almost 4 months of that. And then another program lacked structure, so that they actually wanted to minimize behaviors, which with a bulimic, I mean, less purging versus more purging. And I just didn't understand that approach. You send someone to a treatment center and you want them to feel safe, and everybody around them is acting out.
Well, it feeds into it. If someone sees someone else acting out, it's almost like the excuse, well, if they're acting out, why can't I act out? And it kind of feeds in, I think, into the
true.
energy.
I agree with that. But say, you put someone who's an anorexic in a setting where people are purging multiple times a day, it just feels really unsafe.
Yeah.
And also, again, they're not getting abstinence. They're not doing what they need to do. Again, I've stressed this before, I don't think there's a halfway. Maybe there is the belief that, you minimize what someone's doing. But I really, and the program I was in, people were able to do it. So I know it's possible.
Yes.
They actually described it as non-shame based. You don't shame someone, so you don't force them to do something, but you can provide them with the structure and the way to work through the emotions around the behaviors, so that they won't do it. I mean, they can actually really stop.
Yes. So the key things for you, I know, abstinence and a meal plan, making sure it's a structured meal plan with variety. What else do you think people should know regarding the treatment experience? So maybe somebody who is struggling or suffering out there, who is thinking about going to treatment, never been to treatment. What are some things that you think they should be kind of aware of or know, or kind of go into kind of what to expect?
Well, another thing to assess, and this really depends on where the person is.
Exactly.
Where they are in the disease, whether it's co-occurring, do they have another existing thing such as alcoholism? And then you need to determine what type of medication the treatment center, what's their focus on medication?
I know that's really big for you.
That was huge for me because, someone I was working with was over-medicated in the first treatment center. So when we went to the second treatment center, I stressed, we don't want to use a lot of medication, and it resulted over and over. And even a treatment center in Utah, I don't want to use names, but a very well-established treatment center, which I would have never imagined using that type of approach. That not only was she over-medicated, but they also started using benzos, which is a very addictive. It's probably one of the most, other than I think, I think alcohol is the most difficult to get off of. Benzos are the most difficult. You can die from. Yeah, and they had doctors prescribing it while she was in treatment.
And that's a lot of what I've seen is, when I worked at one treatment center, I noticed a lot of them would come in addicted, cross-addicted, not only struggling with an eating disorder or alcoholism or another addiction, but a lot of times addicted to the benzos. And to see them go through the withdrawal process, because we would withdraw them from the medications, I mean, it was really shocking to me to just see how extreme the physical and the mental withdrawals affected them. We couldn't even really focus on any of the eating disorder stuff because we had to focus on getting them off the benzos, because it really does affect you.
Yeah, and I mean, I can look at my own experience when I went away to treatment. Just a brief review. I didn't get help for about 8 years, so I was really critical. And that also brings up a point, where the person is in recovery. In particular with, say, anorexia, you can be so severely medically compromised that you need that kind of establishment that can deal with that kind of setting. My first 3 weeks, I had to get a transfusion. I was also on a benzo when I came in, prescribed by a doctor. I was in the hospital for a lung infection, and they put me on a sleep med. And I was on that sleep med for almost 2 years, and I could not stop it. So when I've gone into treatment, the first 3 weeks I thought I was going to die.
Yeah.
So to really look at the program, are they medically established to be able to meet the needs of the patient? As in my case, for many, many years, I heard family or friends or people that don't understand the disease, you can do this, and, with outside support. And, I actually saw a therapist and I saw a dietitian, but I really never could have done what I did without the medical intervention.
Yes, and this is what we actually were just discussing is for me as a therapist, the clients that I do work with and I do see who I see some eating disorder symptoms or signs or full blown in a disorder. I was explaining with you, and I think a lot of therapists really need to utilize kind of the best care for your client because there's only so much you can do in therapy. And when someone is so sick in this disease, you need to be able to refer them to treatment and draw that line.
Mm-hmm.
And I think a lot of therapists, we can become scared or we don't want to further maybe damage or reject someone, but it becomes a level of their health. You got to do what's best and always, I think, refer to a treatment center when that time comes. I mean, I utilize therapy to kind of get them around the idea of recovery and changing the behaviors, but I feel like they need the structured care to really implement those changes.
That I agree. That's kind of what when I work with people now, my primary focus is to get them into treatment. Depending on where someone is in an eating disorder, maybe it is possible for them to work with a dietitian, a therapist, and get out of it with that support. It depends on how deep they are in.
Exactly.
But I would say for most everybody that I've ever been in contact with, the first thing I do is assess where they're at. Mm-hmm. And I think, and I'm very upfront with them. I think you need treatment. I mean, you need more support. You can give it a shot on your own. And I've said that repeatedly. And I'm really honest with them. I said, but there's a pretty good chance that's not going to work.
Yeah.
I wasn't able to get treatment. So I actually worked with a therapist for a good 8 years. Wow. And his goal was to maintain me. But I think and I've stressed this before, and I say abstinence is really required for you to make any progress. You can work with a patient who's out there in the real world, acting out in their disease, and then, come see you a couple times a week. They're not going to make any progress. Mm-hmm. As long as they're engaging the behaviors, they're not going to be receptive to do that emotional work.
Yes, because it takes, so much. And this goes on to say it's more than just the food. It's more than the body image. It's an all-consuming disease. And I think that's what we try to stress in every episode is the severity of why good treatment centers need to be located, found, and the right questions need to be asked.
Right.
So do you want to let's go over briefly maybe the levels? What are the different types of treatment centers?
I would say the ideal, we're going to look at ideal. Yeah. And I was actually fortunate enough to get the ideal situation. Mm-hmm. I started out in inpatient.
And what is inpatient?
Inpatient is structured, able to meet your medical needs. Mm-hmm. They can actually deal with the most severe cases. And there's 24/7, you've got nurses on staff, you've got doctors on staff, you've got an in-house dietitian. Depending on how big the place is, the place I was at, 20, 25 patients at a time. And you've got a structured day. You're structured all throughout the day. You follow a meal plan. You're on it 6 times a day. You have the support of an entire community to go through that process.
Yes.
And that's huge. I mean, when you're out in the real world with this disease, you feel completely alone, completely isolated. There's no one like you. I felt like I was absolutely crazy with what I was doing. You get into an environment like that and you suddenly realize, wow, I'm not alone. There's other people that are suffering from very similar things. And maybe and that's when you start to get the hope.
Yeah.
I remember when I first went to Rosewood, I got through those doors and I was suddenly I could just relax and oh my God, I can just put my life over into someone else's hands. Mm-hmm. That doesn't mean they do it for you. It's really hard work. It's one of the toughest things I've ever experienced.
But it seems like you surrendered yourself to the direction that they were going to put you in, the work they were going to give you.
Yeah, it's funny you mentioned that word because that word was repeated to me over and over for every day for 9 months. I was tough. I did my best at surrendering, but it's a daily process, and I still do it. I mean, we can apply surrender to our daily lives. There's traffic, and you get upset and angry. You just got to let go. Surrender's it's a concept. I mean, you think surrender means giving up, but it's really giving over to things that you can't control.
Exactly.
And I had to do that every day. I had to remind myself, okay, I've done this for years and years and I wasn't able to do it. I came here for help. I need to give it over to someone else.
What was there a turning point? I know because I saw your Dr. Oz initial story and episode, and I remember the lady who was at Rosewood, she said that you kind of put up a fight in the beginning a little bit, but then you did surrender and then you embraced the program. Was there a moment for you when it clicked that, okay, I need to really surrender and start maybe?
I remember watching that episode and seeing what she said. And I guess in a defensive way, I thought, no, I didn't. I'm sure I did. I was probably a real pain in the butt. I was actually more, they'd have rules where you'd have to take your jacket off because you can't hide food. And I was there and I really I wanted recovery. I didn't do any of the sneaky stuff. And I thought, I'm not going to do that. So why should I have to do that? I was freezing, for the first 3 weeks. I was so cold and I just didn't want to take my jacket off. I fought in that way. But, I also say this to people that go into treatment. I say, your disease is going to fight back. There are going to be times where you're going to resist. And regardless of how much you want this, it's still going to be there. So again, it's something it's a daily process. It's not something that happens. It's not a momentary, oh my God, okay, I'm going to do everything I need to do right now. It's funny, when I went there, I've got a nephew. I got 2 nephews actually. And at the time, one of them was 3 years old. And I remember having dinner one night at a family dinner, and my nephew he's kind of a picky eater. And my sister was saying, you need to eat this, or telling the child what he needs to eat. And he looked at her and said, you're not the boss of me. And I thought, how absurd is that for a 3-year-old to tell mom that he knows better? So I went to Rosewood, and I kind of shared this with my peers that, I'm going to be like that 3-year-old. I'm not going to tell you that I know better, because I don't. I mean, that's what got me here. And that was something I had embraced and repeat every single day.
And I actually like that analogy, because I think that's so true, is to even get that mentality of maybe let someone kind of, if they know more than me, obviously I haven't been doing this well on my own, let them guide you.
Right.
To make the right, hopeful decisions.
And I think that actually keeps a lot of people out of treatment, their desire to do it on their own. People with eating disorders tend to be high achieving. We should be able to do this on our own. The pride, I don't know, whatever to let go of that. So back to the levels of care.
Yes.
So that was the primary level of care, the inpatient. After that, there's partial PHP. Then there's IOP.
Transitional.
And then there's outpatient. So there's like 4 levels of care. There, when you're actually looking out there for treatment, you hear the term residential, and that's pretty similar to partial hospitalization. Residential can be done in a house where they go to a treatment center and they do programming, but it still provides the structure, the 24/7 structure, and the rules and stuff.
Yeah, that's where I worked at. Actually, my experience was in 3 different residential treatment centers, and it's amazing some of the things that I witnessed and seen, as far as one place that I worked at called themselves a residential treatment center, but it was really run more like a transitional living. And that is something I want to stress and educate to people, because really research, because they were able to check themselves out, come and go as they please. Like you mentioned before, behaviors were actively rampant. These weren't people who had stepped down and were just kind of transitioning back into the real world. They were very sick, but they called it residential, and it was run like transitional.
That's a really good point, because that's what I've discovered here in Orange County. It's a residential program, and you get people that are acute. I mean, they belong in an inpatient treatment center, but they take them in. I don't know, maybe they see it as a business. And they've got people that just can't do the program at that level of care. And that affects the whole community.
It does.
And absolutely, I saw people, they'd go to an outside meeting. They wouldn't have people monitoring them. They could stop at the liquor store on the way. And every room in the house, because I had kind of an inside view, every room had contraband in their drawers, as laxatives or...
it could be anything.
Yeah.
Because that's the part of there's such a sneakiness this is why I think really looking into the rules of the treatment centers, because the other 2 that I worked at were wonderful. It was a long list of contraband. They couldn't have bobby pins. They couldn't have dental floss, like items you would never think. But for the safety of the environment and for all the clients, the necessary things were taken away to really focus on treatment.
And, that's actually really difficult. I mean, you put any average person in that kind of setting, and it's you lose all your rights as an adult. People have to watch you go to the bathroom or flush for you. It's times it's humiliating, but it's a very humbling experience. And that's what I think a big part of recovery is, that humility, letting go and just saying, okay, I'm going to accept the support. So when you're at an inpatient level of care, it's a challenging experience.
Yes.
It's a really challenging experience, but I really believe that oftentimes that's what people really need to get to get to the point where they can actually start doing this on their own. And ideally, as we were talking about the ideal, it's a step down process. You start at a high level of care and you go down to lower levels of care. Unfortunately, the way it works in many places is they'll come into a lower level of care, they'll crash and burn, and they'll be recommended to a higher level of care. In fact, that's what insurance companies want to do. They want to do the lowest level of care,
Exactly.
and then see someone fail, and then they'll pay for a higher level of care. And that's a really dangerous thing to do, because that person failing, that's going to cause them maybe to lose hope. They might not want to continue.
Well, it's traumatic too. I think when you are actively out of control in a place that's supposed to keep you safe,
Right.
it's going to give you a negative, almost fearful connotation of what treatment is, I would believe.
And even a bad experience like that.
Exactly.
I oftentimes I don't talk about some of my experiences. They were on my journey. But I was reaccepted to a treatment center in Wisconsin in 2008 in their residential program, something I'd gone through 10 years before. And when I got there, they forced me to go into their inpatient program. We had signed a contract for residential. It was probably one of the most traumatic experiences of my family's life. They forced me into this inpatient level care, which was essentially a lockdown psychiatric ward.
Yes, and that's important for people to know, is the hospitalization. It is, some of them can be structured like a psych ward.
Right. And we couldn't afford it. It was twice the cost. So I ended up having to go to court. My parents had to fly out to Wisconsin. And it was one of the dark periods of my family's. I mean, my mother still talks about it.
Yeah.
So I think research is really, really important. Oftentimes we're really crunched because someone's really severe and they need help right now. But knowing the right kind of questions can help you guide it. And even with that, it's kind of tough. So another thing, and this is something I stress from my own experience, is when you go to a treatment center, I'd say to my family, I don't know if this is going to work.
Yeah.
I'm going to do my best, but I don't know if it will work.
I think it's important for families to maybe not put so much pressure for the high expectations and just come from a place of love and support.
Absolutely.
Because I feel like if you have that pressure of, okay, well, you're just going to go and you're going to get better and it's going to be all great, that puts a lot of pressure on the person who's going to treatment. And also, it maybe sets up the family for disappointments and more maybe sadness or anger or frustration, whether they let go of expectations and just loved and supported. It might be a better experience for everybody.
I totally agree. When I finally got the chance for that second treatment program, I went into, after the first time I was in treatment, my family didn't speak to me for 2 years because they were disappointed. And I really went into it saying, I don't want any expectations here. And I felt the pressure. I went to a treatment center where it wasn't a fit at all. I mean, it was probably one of the worst programs I could have been in. It was OA based. I think I mentioned this before. It was restriction based, and I was an anorexic in a restriction based program. And 2 weeks into it, I said to my family, "This isn't working." And they said, "Well, this is your last shot. If you stay, if you leave, we're done. We're done with you." To put someone in that position, and I've experienced this with someone I care about. She's been through 4 treatment centers, and I said I would never do that. It's key. I mean, it's kind of tricky because, someone can be in a good treatment program and say, I don't want to be here. I just really don't want to be here. They might fight it. But the reality is it might really not be a good treatment program as well. So to have that open mind and say, okay, we're going to not have those expectations.
Yes.
We're going to hear the feedback. We're not going to treat you as the disease. And to be open to the idea that maybe this isn't working. I often say, because I'm the kind of person, if I'm reading a book and it's not good, I put it down and I start a new one.
Yeah.
Some people have to finish that book. And some people feel that way. Like for a treatment center, you're going to stay there and make this work.
Yes, regardless.
Or this is your last chance, And sometimes it's worth a switch.
Yeah, it's one of those things where I try to really empower families, clinicians to not, I guess, focus so much that if something that someone who's struggling with the eating disorder says is because they're fighting, trying to protect the eating disorder. I really stress that sometimes there may actually be concerns or issues, like you mentioned.
Right.
There could be something going on with treatment. A theory approach between a therapist and the client may not work. And if we just assume, well, it's your eating disorder talking to you, it's your eating disorder fighting, that's, I think, the negative thing that families and the professionals do is you cannot, I guess, limit someone to their disorder.
Yeah, and just listening to you describe that, I'm getting flashbacks of being in Rosewood and people running away from the treatment center. I mean, literally, we're in the middle of the desert. There's snakes and no water around, and people are running away. I remember one woman, she ran away and tried to cross a river in her Ugg boots, and so there are people. And this program was a good program. For me, it was a good fit. So that's also the disease, and they don't want to be there. They're not ready for recovery or whatever it may be. So there's a real fine line in trying to figure out, what the right program is, having an open mind, being willing to be receptive to that kind of thing. So it's not an easy thing to navigate.
So for you, I know we mentioned the step down level process. So there's the partial hospitalization or inpatient, residential. Were you able to do IOP or PHP?
Again, yeah. I was given the gift of unlimited treatment,
Yes.
which was amazing. And that's what I say. The highest correlation of recovery and whatever process you do is the length of stay. I was in inpatient and partial for 9 months.
Mm-hmm.
And then I did the intensive outpatient where I lived in a house with support for almost 11 months. And then after that, I ended up staying another 3 months in my own place, tried to experience it by myself with the support of a treatment team. So I was able to do what I learned in inpatient, step down, start to engage more in healthy behaviors like cooking and learning how to prepare things, and then actually live it in an intensive outpatient setting, and then do it on my own. So it was like a step down where I continually reinforced those behaviors that I learned. Just like in your disease, you get stuck in these old behaviors.
Yeah.
And I often use it as, I'm a biologist, so I like to describe it as that you have a brain. And on your brain, every time you learn a new behavior, you get a groove. You repeat those negative behaviors, that groove gets deeper and deeper and deeper.
Yes.
So you get stuck in that groove. So in recovery, as you do the step-down process, you create a new groove and a new behavior. And the more you repeat that, the more likely it is to stay in that healthy groove.
And I think that's why it goes back to why abstinence is so important and key.
Right. Actually, because you jump right back into that negative groove. And it's difficult to make any progress. So, and again, I've said this before, it's kind of like practice. You just do it over. And I think Amy mentioned it as well. Once you start to learn to do that, then everything else opens up.
Yeah.
So finding the right level of care, ideally the highest level of care would be best. Even if you're able to do a high level of care and step down, rather than go through the process of crashing and burning and going to a higher level of care.
And I think that's what's important is for people to know what to really look for and not maybe just take what's told to you about a program, but feel free and empowered to ask the questions, ask how the staff is trained, ask what the meal plan looks like, and ask, what their structural day looks like. I know a lot of times one of the treatment centers I worked at, half the day was spent sitting around watching TV.
Right.
And I had adolescents, because this was an adolescent home, asking me, we want to learn something. I came here to be taught ways to navigate my life, but it's not in the schedule. It's,
Well, not only that, I mean, that idle time is time for your brain to go where it shouldn't go. And then that structure is really important to keep you engaged throughout the whole entire process. I'm just curious, being on the other side, you say you worked in 3 treatment centers. You had a negative experience, and therefore you decided to go out on your own. What would you see as the biggest negativity as far as what you've seen?
It's. I think there's a few things. I think one of the things that really kind of disturbed me, and I think you mentioned this, but as far as the meal plans go, I think overexposure of actually really unhealthy foods that I didn't see the benefit. It was more traumatizing. I think challenges are great. They're important. Exposure is important. But when it's an everyday almost flooding of that, it was troubling for me to see, because I would see the trauma on the individuals who were in the treatment program. And I think some of the staff, it was almost like they were babysitting. So they weren't really engaged, that you could see they were bored, they were not interested, they weren't really monitoring what's going on. And I think for me, that was also really challenging, because I was there. I was passionate. I wanted to help. But then you have other people who maybe are not there for those reasons. And I think it's important to have a caring, really supportive staff who understands what to look for.
Which, I just thought of something, a major thing that you might want to ask when you're looking in the treatment centers. How many of the people that are actually on the treatment side have had the experience themselves? Some of my best therapists or dietitians that I respected the most were recovered from an eating disorder. They really were able to have that empathy, understand where I was coming from, and they really got it.
And this is what's difficult, though, because when you go to work in treatment centers, that's one of the number one things that they tell you. If you've ever had an eating disorder, don't disclose it. Don't talk about it. If they ask you, they tell you how to shy away or to change the subject. But like I agree with what you said. I think it's important, and it can actually help a lot of people struggling to know that someone else who's helping them has been through the other side and recovered.
Right.
And so that's the fine line. I guess it's
Yeah.
But is there any final thought that you would like to impart about our topic or in general about anything?
Well, I'd like to say we're open. We're open here to support anybody who calls in or needs support as far as navigating. NEDA actually has what they call navigators, a National Association of Eating Disorders, that will help you through the process as well.
Great.
The thing is, families need help to find the right treatment centers, as well as the individual. You need an advocate to get through the process. And you need an advocate when you're in treatment. You need someone to help support you while you're there.
Yes.
But again, and I've stressed this before, when I work with people, primarily that's my goal, is to get them into treatment. I think that really is the key to recovery from an eating disorder, is some form of treatment.
Yes. And, we just want to let you know, we'll put some links like we do on our sites, as well as both of our emails. So you can feel free to reach out with questions if you need support, you need, someone to guide you, obviously very experienced and knowledgeable. And also we want to do a live show in the future.
Yes.
So if you have any questions that you would be interested in us having us answer or ideas, we would love to hear them.
And keep an eye out for Dr. Oz. Somewhere around Christmas time, there's a Pro Anna episode, Dr. Oz Pro Anna. If you Google that, you can see the original episode.
We'll put the link on the
page, it should be pretty exciting.
Well, we're excited for you. And, I think in general, this is even why I'm excited about doing this show with you, is because just getting the message out there and talking about it. And the more that we talk about eating disorders and educate and awareness, I think the more we can help people.
Absolutely.
Yeah. Well, thank you.
All right.